Welcome to this talk on our new aortic clinic. My name is Dr. Rithin Rathnakar and I'm an advanced cardiothoracic surgeon at Sir H. N. Reliance Foundation Hospital and Research Center. The aorta is the largest artery in the body and supplies blood from the heart to the rest of the organs, including the heart itself. Therefore, surgery on this structure needs a lot of experience and training. An aortic clinic comprises of a team of cardiothoracic surgeons, interventional radiologists, cardiologists, radiologists, and genetic counselors. Patients with aortic diseases such as aneurysms, which is an abnormal dilatation of the walls of the artery, or dissection, wherein blood seeps into the layers of the artery after a tear in its inner lining, are treated here. In the aortic clinic, a multidisciplinary approach to the care of these patients is taken, which includes diagnostic studies with cardiac CT and cardiac MRI, risk assessments, and treatment planning, which includes open surgery, endovascular repair, or hybrid approach, or in some cases medical management. The advanced surgical options include, but are not limited to, replacement of the aortic root and the ascending aorta with a prosthetic valve conduit, or preserving the native valve and replacing the root, which is also called a valve-sparing root replacement, or advanced surgeries such as replacement of the aortic arch with or without a frozen elephant trunk technique. In addition, as aortic diseases have a genetic and familial inheritance patterns, genetic counseling is offered to the family for risk assessment and follow-up planning.